One of the reasons people come and see us particularly is because they've developed a wound on the lower aspect of their leg, and they may have had this for some time or even only for 2 weeks. This can be really painful, cause them a lot of discomfort when they're in bed at night or when they're walking. It could even stop them working or carrying out their daily activities. It can also have a huge impact on their relationship. If you have a wound on your lower limb, you must see a specialist as soon as possible, even as early as 2 weeks, so that we can start your treatment and get you healed and get you back to your normal life as quickly as possible. So Lukla, tell us, how do patients go about sorting this out? What should they be doing?
Yes, Jemell. Well, actually, varicose veins are the main cause of venous leg ulceration. And varicose veins are tortuous veins, superficial veins under your skin that have lost the ability of draining the blood and the fluids from the lower extremity back to the right side of your heart. For that reason, if you have varicose veins, you have an increased blood pressure inside your veins that we call venous hypertension. And venous hypertension is exerting damage on your skin that can start as a simple staining of your skin, especially around the ankle and the shin.
Because we know one of the classic signs of venous disease is pigmentation or brown. We call it hemosiderin staining, but you will see it as brown pigmentation. And some people think it's a birthmark, where actually it's not. It's a change in the skin tone of the skin, and it's a classic of venous disease. So if you have that on your leg, you need to be seeing a vascular surgeon.
Yes, because the late stages of these venous changes could easily be a breakdown in the skin of your lower extremity that turns into, as you said, an ulceration.
And you may also be predisposed to venous disease or venous ulceration. So you may find in your family that your mother or your granny has had an ulcer, or that they have varicose veins. You may also have had some orthopedic or trauma when you were younger, such as playing football. You may have broken your leg, or you may have some reduced mobility in your leg or the limbs themselves, which means that you don't use the normal dorsal flexion of the foot. These all actually impair the normal venous return to the heart and can lead to varicose veins.
Yes, and the data shows us that 2% of the people aging 65 years or older, they will experience a venous ulceration during their lifetime.
As well as the older population that we see over 65, I've also seen in my practice an increase in hairdressers, chefs, nurses, people who spend long hours on their legs developing varicose veins, or actually heavy aching legs. And there is treatment, there is things that we can do to help you with that. Even if surgery isn't an option, there are other therapeutic options that we can discuss with you, such as I wear compression hosiery all the time to prevent me getting varicose veins, because they are in my family. So we can talk you through what works for you.
Yes, Jemell, actually compression therapy has proved to be effective to improve the ulcerations. However, they don't treat the underlying reason, which is, as we said, venous hypertension. And that's why surgical treatment is paramount to prevent or heal your leg ulcerations.
And I think just taking it back another step as well, Lukla, it's really important if you're out there and you are having treatment for a venous leg ulcer, or you are having compression in some form, have you had a venous duplex scan? Have you actually had a proper diagnostic test of your veins? Because more often than not, that hasn't been performed. And although you're having the treatment, you may not have had that underlying diagnostic, which is really, really important. So if you haven't had that, then you need to be asking for a referral for it.
Yes, the UK NICE clinical guidelines are actually stating that all patients with a leg ulceration should be timely referred to a vascular service with the view of having an ultrasound duplex assessment of ideally both their veins and their arteries. Because as you know, ulceration can be a result not only of venous disease, but sometimes of a combination of venous and arterial disease. That makes the prognosis of your leg ulceration much worse, and the possibility of treatment complex yet feasible.
I think the good news is that if you have a wound on your lower limb and you're watching this, then you're on the right track. We're the specialists in the area. We've been working in this field a very, very long time, and healing is possible, and also prevention of it happening. Sometimes people are sitting at home and they've been living with this wound for months, sometimes even years. I've seen people, but there is good news. If you see the right person at the right time, then we can get the treatment started. You can get the underlying diagnosis. So it's really important to reach out and to have that second opinion if you need it.
Yes, the modern treatment of a varicose vein has replaced the old-fashioned surgical stripping of your varicosities. We nowadays use a minimally invasive keyhole procedure, where with ultrasound guided needle puncture, we go inside the vein, we use catheters and wire, and actually the catheter has a heating tip that burns the main vein, either the long saphenous or short saphenous vein, and by burning the vein and letting your body reabsorbing the vein, that will automatically reduce the venous hypertension.
And I think the recovery time is a lot quicker, and aesthetically it's a lot better as well for people. So definitely there's been an advancement in the old-fashioned varicose vein stripping.
Exactly, we can do that as a walking in, walking out procedure just under local anesthetic.
So lots of advancements there, and I think from us who've been working in the field together a long time, we know what works, and certainly we know because you've told us. So we're here to say, get in touch, have the assessment quickly by both of us on the same day. You can see Lukla and myself. We can get a treatment plan started and get you healed as quickly as possible.
A recent clinical trial, which is called IVRA, and which has been conducted in over 20 centers across the UK and has randomized 450 patients, has actually showed that timely compression therapy, as long as performed by experienced and trained nurses, together with the varicose veins treatment, with the keyhole procedure, the thermal ablation treatment, the two treatments together have significantly reduced the time of healing of venous ulceration and improved the risk of recurrences.
So I think you've touched on two really important areas there. One is by a competent practitioner, and you may already have had compression or are having it now and are asking yourself the questions, well, it didn't work for me, it hasn't healed. Certainly there needs to be questions over who is applying it, are they competent, have they got the skills and expertise, but also the consistency of that. Like all good things in life, if things are not consistent, then it's likely you're to go back 2 steps rather than forward. So consistency and competence are absolutely key with compression. It's an old-fashioned but gold standard therapy for venous leg ulceration, but it works, and it works really, really well. So you need to be seeing the right person, you need to be seeing them often, and that may mean taking a look at who and where you're going at this point in time.
Yes, the secret is not how good the surgeon is, but it's the teamwork between the surgeon and the specialist nurse.
It's definitely a teamwork. You can't have one without the other, so you can't have good nursing care without having that proper diagnosis and also that underlying investigation and, I suppose, surgical intervention if you need it. We don't work in isolation, and that's the really, really great thing about us together. Our take-home message is, don't be sitting at home worrying about what's happening. Get in touch. Things are absolutely healable. We work together to make sure that care is consistent, safe and effective, and we're also here to understand life around your wound and what's been happening, and we can look at all of that together.
Yes, varicose veins treatment together with compression therapy can change your life, improve the quality of your life, and ultimately prevent or treat your ulcerations.
We look forward to seeing you.